Hi everyone, my name is Dariush Rezai, student ID N41371728. Module leader Dr. Sandra Akwara, module name Continuous Professional Development. Introduction. In this presentation, I will discuss about continuous professional development and how it's affecting healthcare. Then I will explain how to plan my progress. In the following, considering the critical incident and analyzing it according to the Gibbs reflective cycle. And finally, I will talk about employability skills, importance in the healthcare, then about my own employability skills, along with several examples. Continuous professional development. Professional development itself refers to individual enhancing their skills, knowledge, and ability in a professional context. The progress uses variety of educational and experiential resources to include the professional who achieve the best performance in the workplace. Practice development in the workplace. Training employees during the work is very important, one of the base methods of the human resource development in the organization. Training during at work process, in addition to increase the skills of the employees, helps to improve the organization performance and improve the client satisfaction. Person-centered care. Those for whom social service are provided, they have fully role in planning and how to provide service. And all service are adjust around the exist of their life and needs. Keeping the person in need informed how the service is one of the main method of the providing high quality service. Practice development in the health sector importance, reducing the layoff and retaining the employers, increasing employee performance in the group work, improving quality and maintain professional standards. It strengthens of efficiency of the employers and make their work more effective, strengthening morale and increasing employee satisfaction, training skills managers for the future of the organization and improve organizational communication. Plan for CPD. To achieve access and progress, the SMART goals method is one of the most effective. In this method, we must consider five principles that our goals are specific, measurable, attainable, related to ourselves, and within the specific time frame. So, in my development needs, I mentioned four development needs. How I get that development needs, we analyze myself according to SWOT analysis. So, uh, weakness, strength, opportunity, and treatment. So the weakness became my development needs. Time management, one of my first needs. Type of development is online training and course. Timeline 3 months. Who is responsible? Me as a staff, or I have to talk to my manager and I ask for supervision. Assertive, one of my another development needs. A type of development is course and online training. I give just 4 months to this development. Who is responsible? I can talk to my manager, ask for the supervision, and discuss my weakness to my to my manager and staff. Me as a staff make a decision. I want this development. Comment, reading book regarding the assertive. Another development needs academic degree. Type of development, university and colleges. Timeline 2 years. Who is responsible? Me as a staff, because later I'm gonna go to higher position, so I need academic degree to get that job. Writing skills is another development need. Type of development is reading and online trainings. Timeline 6 months. Who is responsible? Me as a staff. Comment, practice with friends. Development activities, learning activity. We have a two type of the learning activity, formal and informal. Formal activity is said to be those activity that the members of the organization learn from educational centers outside of the organization, and it has the possibility of high cost. For example, university, colleges, and known free online courses. Informal activity is said to be those activity that the member of the organization might learn experientially through the usual role. For example, work shadowing, online courses, sharing the information online, such as WhatsApp group or face to face, reading the book relevant to our job, and mentoring. Reflection. What does mean reflection? Reflection is a personal analysis that allows you to align your life and career with what you can do. Module of the reflections, how to start the process. They are different type of the reflection, and they choose one according to their preference. I mentioned four type of reflection. First one is era reflection cycle. Second one is Kolb's experiential learning cycle. And third one is Discroll what model. It means what, so what, and now what. Gibbs reflection cycle is one of my favorite and have a 7 steps. Critical incident analysis. What does mean critical incident? Critical incident are those incidents that happen out of ordinary and unexpectedly. It can have positive or negative effect. For example, if some staff broken the arm or legs of the client accidentally, or given wrong medicine and even lead them to the death. Critical incident analysis have a few steps. The first one is what did happen? What did this happen? Background of the incident, who are involved in this incident. What happened? This is the second one. The detail of the incident and how it happened. What did you do and why? Feeling. What were you thinking and your reaction at the time? What do you feel after the incident? Important of the other team members. What was the other reaction? Did they react differently as you? Evaluation. What skills and knowledge did you use? What did you do well or wrong? Learning. What did you learn about yourself? Your skills and the other team member skills was enough? What you could do to avoid such an incident does not happening again. Critical incident. My reflection during and after the critical incident according to Gibbs reflective model. Description. One of our clients died of corona after being transferred to the hospital. At the beginning of the outbreak of corona, my work shift started at 9 o'clock in the morning. As soon as I entered to the work service, I noticed that the night staff was very stressed and hurriedly talking about one of our clients who is in the very bad condition. I had just started working, immediately run to his room after wearing mask and apron. I saw him in a position where he was trying to breathe, and hissing sound could be easily heard from his chest. We immediately called the ambulance to take him to the hospital. The ambulance arrived to our place almost half an hour. After receiving the required information, they transferred our client to the hospital. We informed the manager what happened. After 2 days, when I was working, they called me and told me that he died. And the cause of his death was announced in corona. Feeling. When I heard this news first, I didn't worry too much. But when I saw the patient who was in a very serious condition, it was very stressed. It, I was very stressed. But as a three workers, we were together and tried to control the situation. I tried my best to be calm and tried my best to convey the calmness to others as well. Evaluation. What did you We did our best to control the situation until the ambulance arrived, and it was very harm working and it was very heartwarming to see the colleges helps each other and the client with the uh, it was very heartwarming to see the colleges helping each other and the client with all their experience and offers. Analysis. We are not one person, and all members of the group do their best to reach the goals, showing compassion and empathy towards the client and the other members of the groups, feeling responsible towards the client in the critical condition, using the necessary skills during the critical incident. Conclusion. A lot of such incident will happen in the care centers, especially during and after the corona. One of the most effective ways to control the situation is to keep calm and try to control the situation, because many employees of the care homes suffer from the discomfort and depression after the death of client. So and therefore using the efforts will reduce the employees' consciences. Action plan. After this incident, we decide talking more to each other and find our weakness and cover them and increase the cooperation and increase the collaboration and working together. Employability skills importance. Employability skills are those skills that improve the cooperation with your colleagues and make your work more effective. These skills are also said to mean other soft skills that are useful in any job and make us more attractive to our employers. And these skills are often not in the job description, but they are very useful in the job in the futures. I mentioned few employability skills here. That is communication, such as writing and reading, problem solving, leadership, technology. I could say we don't need to be IT manager, so knowing about computer and system, it's very good. Motivation. Having the motivation bring us close to our goals, and we are ready to work for success, and we are not be disappointed during the work. Reliability. We are reliable person, and our employers need our ability, and we don't make any false promises, and we don't do anything out of job. So whatever we agree, we do that. Work in the group and flexibility. Flexibility is very important. Always employees in the job interview asking how flexible you are. So if someone gets sick and doesn't come, you are able and go and cover the shift, or you're able to do day shift or night shift. My own employability skills. Each person employability skills are different and is depend on their own experience, environmental condition, and the society where they are come from. Regarding my employability skills, I can refer to several ability that is seen in myself, that is very effective in my job. I could say communication, work in a collaboration, time management, creativity, organized person, reliability, and respectful. So respectful not towards the client, even respectful towards the other staff. Compassion. This means that the care should be based on the persevering dignity and being kind and paying attention to their feelings. That our care and support be accompanied by taking them and understanding their view of the care. Compassion is not only related to the people who use the service. Care workers must show compassion towards the colleagues as well. For example, people who go to the health centers suffer from the pain and various disease. Health workers must understanding their condition and put themselves in their place. This means that if we are instead of the sick person, what do we expect from the health workers? Talking to the patient and explain the treatment steps can help a lot on the patient mental health. It gives them the confidence that you are not abandoning them, and the staff will do their best. Thank you so much for listening to me, and I wish best. Bye.